we are going to trace the superior thyroid artery. This is the common carotid artery, this part, and at the upper border of the lamina of the thyroid cartilage, common carotid artery divides into an external carotid artery and internal carotid artery. From the external carotid artery, just below the tip of the greater conva of the hyoid bone, this region, the superior thyroid artery arises. This is the superior thyroid artery. This one is the superior thyroid artery. The artery passes downward and forward, accompanied by the external laryngeal nerve. This is the external laryngeal nerve, this nerve that lies posteromedial to it, and the artery rests on the inferior constrictor muscle, and they pass deep to the strap muscles to reach the upper pole of the thyroid gland. The strap muscles include omohyoid, stenohyoid, and sternothyroid muscles. After it reaches the upper pole of the lateral lobe of the thyroid gland, at this region, it divides into its terminal branches, and all the branches lie superficial to the thyroid gland. But as we can see, the external laryngeal nerve passes deep to the thyroid gland. Let's see about the branches of the superior thyroid. First, it gives origin to at the lower border of the hyoid bone, it gives off an infrahyoid branch, and it anastomoses with the infrahyoid branch of the opposite side. Next, when it passes side of the thyrohyoid membrane, it gives off another branch, that is the superior laryngeal nerve artery, that is going to pierce the thyrohyoid membrane, and then it descends downwards, then it gives off another branch by reaching over here, that is the cricothyroid branch. The cricothyroid branch passes across the cricothyroid ligament and anastomoses with the fellow of the opposite side. Next, another branch, that is the sternemastoid branch. Here is the sternemastoid branch. This branch is going to supply the muscle of the same name, that is the sternemastoid. Then, after reaching the upper pole of the lateral lobe, it divides into terminal branches. The terminal branches are the anterior branch and the posterior branch. The anterior branch accompanies the medial border of the thyroid gland and anastomoses with the fellow of the opposite side on the upper part of the isthmus. The posterior branch passes downwards along the posterior border of the lateral lobe and anastomoses with the ascending branch of inferior thyroid artery.